Hello,
Hi.
my name is Nathaniel. I'm the nurse recruiter.
Hi, I'm Elizabeth.
It's nice to meet you.
Nice to meet you.
See, this interview is for a full-time RN position of the general peds floor, correct?
Yes, I also brought copies of my resume and my portfolio for you to look through too.
Great, thank you. All right, let's get started. Do you have experience in general peds floor?
I don't have experience on a general peds floor, but I was able to do my preceptorship on a children's peri-op unit at BCU, so I was able to see the patients before and after going to the operating room and being able to see all ages and work with parents and things like that, but not general floor now.
Okay. See, define teamwork.
I think teamwork is really important in a nursing career, and to me in particular, but we rely on each other for so much to be able to pull patients up in bed, to verify for medications, and for anything that we might need. You know, you don't always know walking into a patient's room what you're going to expect or see each time, and just being able to have that support or have somebody that you can be like, hey, can you come in here with me, is really important to me. And I, especially as coming onto the unit as a new nurse, I'm going to have to rely on people for a lot to be able to learn the ropes and to understand what's going on and to ask questions. And I have no problem asking questions, but it's nice to be able to have that team to back you up and to be there for you. And I will always be willing to help anybody else because I would want the same for me if I was in need too.
Good. Where do you get your sense of motivation?
I think I get my motivation from my patients. You know, I take pride in being able to help them every day, to advocate for them, to be supportive for them, to help them get better, and leaving each day feeling really happy and rewarding, and knowing that I made a difference in somebody else's life gives me the motivation to be able to come back the next day and do it all over again.
That's good. How do you organize yourself for day-to-day activities?
I'm a very organized person. I like to have everything laid out. I have a planner, I have sticky notes, and keep myself all straight. But I know in the nursing field it's hard to be able to stick to one plan and go with it all day, or to lay everything out. So I know over the course of the day things are going to be changing, and to kind of just go with the flow and be able to redo my sticky notes throughout the day is something that I know I can do. But on a day-to-day basis, I tend to stay pretty organized.
Great. What do you enjoy most about your last job?
I worked at a daycare over the summer, and I was the main person to be able to give medications out to all the ages. But one in particular was a little diabetic boy who just got diagnosed a couple months beforehand, and being able, he was kind of shy, not really warmed up to me at the beginning of the summer, but over the course of the summer to the ends, him being able to give himself his own insulin, being able to pick where he wants to give the insulin shots at, and being able to tell me, hey, I feel kind of low, like maybe we should check my blood sugar, and being able just to have that open communication with me was really cool and really helpful for a job like this.
What are your most remarkable skills?
I think my most remarkable skills that I can bring to the unit is just my compassion, my willingness to work hard. I want to learn. I want to be the best nurse that I can be for my patients. And I'm a team player. I want to help everybody out and in return for them to help me out. And I think my knowledge and my degree that I'm getting, I'll be able to really be confident in what I do and be able to do that much better, having a good foundation going into the job.
Good. What kinds of decisions are most difficult for you?
I have a hard time making decisions that affect others in a way that they don't necessarily want. I'm very big into kind of putting others first and making sure that everybody else is pleased before myself. And so if I have to make a decision that doesn't please them, it's not always fun or easy for me. For example, I was an RA in college, and so if I had to write somebody up or do something for other people, they weren't always happy with me, but they eventually turn around and be like, okay, I was the one in the wrong, like, you're right, like, that sort of thing. So I can make those decisions. They're just not always fun for me. I'm not something that I enjoy
Right.
doing.
All right. What courses did you get the worst grades in, and why?
I think the worst grade that I got was in pharmacology.
Mhm.
We took it in our very first semester of nursing school, so you're trying to adapt and learn how nursing school works, and then you're thrown in this very heavy curriculum kind of class. And it was a really good overview of everything, but it was really hard to really understand and retain a lot.
Mhm.
But then going through med-surg, we had 3 semesters of it, and we broke down each body system, learned about all the medications for each body system and what each thing can do. So then if I was to take it at the end of the semester, I feel like I would do a lot, or at the end of the year, at the end of the all my, like now, as I'm about to graduate, I feel like I would do a lot better than
Right.
very first semester as a baby nurse, so to say.
Yeah. All right. Tell me about the one thing in your life you're most proud of.
I think I'm most proud of just my sense of adventure and tying that in with mission work. I really love being able to go to other places and to be able to provide healthcare and use the nursing background that I have to give to people who don't always have healthcare. I was able to go to Brazil over spring break with my school, and we were able to provide healthcare to 500 people and teach children how to brush their teeth for the first time, and be able to give joint medication or pain relief for joints like ibuprofen and things like that for the hard workers that are out in the fields or rowing boats or something all day and just are always in pain, and how excited they get over a little bit of ibuprofen or a toothbrush and toothpaste. It was just so awesome to see, and just bringing that back into care here and just being able to just provide that compassion and that love for helping others is just something that I just love doing and am most passionate about.
That's nice. Why are you the best candidate for this position?
I think I'm the best candidate for this position for things that I mentioned earlier, but just like my experience with kids. I was able to do my preceptorship with kids. My mom's running daycare around the house, and I worked at a daycare, and I just always surrounded myself with kids. It's almost like second nature to me. I just adore children, and having that experience at my preceptorship, I was able to really learn a lot about therapeutic communication with parents and children, and how sometimes surgeries don't always go the way that it's what's planned, and parents get upset and even kids get upset, and just learning to kind of just sit there even if it's in silence and just being there as that support system. And I've learned a lot about things like that. And then my degree from Shenandoah, they really prepared you well. We have great staff and a great new labs and facility for us to really just grow a lot in, and I'm able to go in confident to a job and feel like I have that basis of knowledge that will really help me a lot in a job.
All right, that's good. Let's see, tell me about your most memorable patient.
I think my most memorable, it's not necessarily a patient, but it's kind of like the child I talked about earlier is my diabetic child, and starting off with very slim to nothing, working with him and being able to really have that good communication afterwards was just something that I love doing, and being able to give him his independence by letting him choose where he wants his insulin shot and being able to set it up for him, but him able to get it. And talking about what his blood sugar was, and he knew if it was high or low or where it should be based on the numbers, and just being able to work with him every day was really something that was very rewarding for me, and something that I know I can use in a job like this.
Right.
As far as patients go in the hospital, we had I was on the renal med-surg floor for one of my rotations, and I had this older man who had renal disease, and his kidneys were beginning to fail, and so he goes to Johns Hopkins a lot, and he's getting this new contraption coming from his bladder that will allow him to pee like a normal person, even though his kidneys aren't able to perfuse as well, and he'll be able to push a button and go. So he'll seem as normal as possible, and he'll feel normal going to the bathroom, but he won't have as much, he won't be going like everybody else. And he was so great about explaining it to me and talking to me about it, and I learned a lot about renal disease, and learned a lot about his situation, and he was just a great learning experience and was so easygoing and wanted me to learn, and that was really cool. And he's been one of the patients that stuck out the most with me over all of my clinical rotations.
That's good. See, what do you expect from your supervisors?
That's a really good question. I'm glad you asked that. I think sometimes supervisors can seem like very intimidating, and it's like, oh, have you talked to her today or talked to him today? And you don't want to necessarily go to them all the time, but I want to be able to have a relationship with my supervisor. I want to be able to go to them if I'm having a bad day or if I have a question, and then in return them be like, hey, Elizabeth, can you help me with this, and kind of have that support for one another. And I think that's important, and it's kind of like with the teamwork like we talked about, just having them to be part of like as our team. Like, even though we have our colleagues and they're our supervisor, I still want them to be like, feel like a team to me, and to be able to have my support and they get my support in return. And I think that's really important.
All right. See, thank you for coming in. You'll hear from us in about 1 week. Did you have any questions for me?
I did have one. We kind of mentioned like coming in as a new nurse, and it can be very overwhelming and very intimidating coming on.
Right.
And I was just wondering how long that you guys have as your orientation period for new nurses coming into a unit.
It's 12 weeks, or it's longer if you need it to be.
Okay.
So you can get more well adjusted, So.
Okay, great. That's a good length.
Yeah. All right. Well, thank you for coming in. It was very nice meeting you.
Thank you. You too.
All right. You have a great day.
You too.